The sun no longer sets on Nigerians. This is because Nigerians can now be found in virtually all nations and regions of the world. In Tall Drums, we bring you stories of Nigerians making remarkable contributions to the improvement of the human condition. Here is your host, Dr. Ugoji.
Welcome to Tall Drums, a Nigerian-American journal. Our guest this week has combined the gift of medical healing and scientific research knowledge in a manner that has made her uniquely qualified and experienced in pharmaceuticals and biologics. In a national television advertisement produced and ran by the Pharmaceutical Industries of America, Dr. Henrietta1 can be seen telling the world about breakthroughs in that industry and how that industry is changing the quality of life and longevity for all Americans. She is currently the Vice President for Worldwide Regulatory Affairs in the pharmaceutical section of Wyatt, a leading pharmaceutical company.
When they told me that I was HIV positive, that was the single worst moment in my life.
When AIDS was discovered 17 years ago, pharmaceutical companies started immediately looking for treatments.
I was terrified. It finally hit me as I was going into the hospital. I did not want to die.
Pharmaceutical company researchers worked around the clock looking for something that would make a major impact.
If I didn't have this new medicine, I would not be here. It is as simple as that.
Since the advent of protease inhibitors into the combination therapy, AIDS mortality in the US has been reduced by about 50%.
I really do believe that there can be a cure.
I would hope that my place in the universe is to give my best to improve humankind all over the world.
According to your biography, you were born in Enugu, the coal city, the second of 9 children, I understand. Could you tell us a little bit about your childhood and growing up in Enugu?
It was a beautiful experience, and I'm still very nostalgic about the experience. Yes, I am the second of 9 children. There's 8 of us that are living today. We lost our brother during the Civil War, the Biafran-Nigerian Civil War, on account of one of the air raids, and we were all there to witness it. It was a very traumatic experience, but the memories that we have of growing up in Enugu are very, very pleasant.
Quite often people talk about their relationships with their mothers because mothers are quite prominent in our lives.
Yes.
I want to ask you about your relationship with your father, though. What was that like?
It was a very special relationship. And as you pointed out, sometimes unusual, especially between girls and their father. I think actually they should be better between girls and their fathers because of the Oedipus complex. But I did have a very special relationship with my dad. He taught us primarily about God. He taught us to love and fear God. He brought God as a real entity in our lives. He made prayer to be a profound part of everyday living. And it was not just lip service prayer, but prayer that would eventually form who we ended up being. And I still believe very strongly that the grace from his prayers and the way he taught us as his family, his wife and children, have continued to sustain us and kept us bonded as a one unit loving family. Now, my father and I were very close because you know how Nigerian parents are very much interested in the academic prowess of their children, and I happened to be quite good in school, and he enjoyed that. And I also enjoyed going to him, which, you know, dads always have this fearful awesomeness around them that could sometimes scare the children away rather than bring them close. But I found a way of getting through that and really getting to the heart of my father, such that when I left to the United States and, you know, starting my career and working, there was hardly any day that went by that I didn't pick up the phone to call him. So when we lost him in 1996, for all of us, not just me, for all of us, it was a very traumatic experience. I focus on myself because you asked the question about my relationship with him, but I think every one of my sisters would also relate a similar pleasurable experience with him.
Now, at some point at your university level, you decided to go into medicine.
That's right.
Why?
Well, several reasons factored into that decision. While we were in high school, I was good at just about every subject, so I could have done anything. And as a child, I thought that I would like to be a history professor. I would actually get up in front of the class, and I was quite little, so I would have to stand on a chair to try to teach. I also loved French, and I thought again that I might be a bilingual assistant to some diplomatic entity. But as you know, in Nigeria, when you get to the third grade of high school, which we called class 3 at that time, you would then have to streamline from the multiple subjects that you're taking to something that would actually chart a path of a career, professional career. And I did have experiences earlier where I was quite ill. I had to be hospitalized 3 times during my first and second grades in high school. And I really enjoyed the experience that I got from the doctors that treated me. And these were family physicians, Doctors P.I. Okolo and his deceased now, may he so rest in peace, and Professor Ichi. These were true professionals, and we also had a radiologist, Dr. Michael Ogapu, who's also deceased, may he so rest in peace, that were like grand models for me. And we talked about this a lot, my dad and I. And you know, in Nigeria, when you, at least in those earlier days when you were good in school, there were a number of professional entities that would be presented to you for your interest, you know, medicine, engineering, architecture, and things like that. And we had a conversation, and my dad suggested that since I was very good in the science courses and I had this great interest in what my physicians had done for me earlier, that I should consider the path of medicine. And that's really, amongst many other discussions, that's really how it started.
Okay. And at some point you decided that, I believe in the 80s, you decided to come, was it in the 80s or 90s, to come to the U.S.?
In the 80s.
In the 80s,
yes.
Correct, right. Obviously to pursue graduate work.
That's right.
In medicine.
That's right.
Okay, why the United States though?
Well, again, here is where my father played a strong role. While in medical school, he actually offered me the opportunity to have what we call externship, so that I could expose myself both to the British system as well as to the American system. And we had a close family friend that was in the United States at the time. So he arranged for me to come to have my summer holiday in 1979, which was after the second professional exam, what we call the second MB in Nigeria, to spend some time in some of the hospitals in New York, the Downstate Medical Center in New York. So I spent 4 weeks as an extern, you know, shadowing the physicians and going on rounds with them. The technology was simply amazing. Now, meanwhile, I had also exposed myself for a very brief time to St. Mary's Hospital in London. And I then made the decision that I would like to pursue my postgraduate work in the United States.
Tall Drums is sponsored by Songhai Corporation, publishers and consultants.
I present to you the 1999 Outstanding Woman in Technology Golden Torch awardee, Dr. Ukwu.
Thank you very much, Dr. Gladden Green, Dr. Eve Slater, for those gracious words and wonderful introduction. Thank you, Nesby, for this wonderful occasion and for recognizing young professional African Americans. I feel very humbled and truly proud and very privileged to be here today to accept this award as Outstanding Woman in Technology. For this and many other blessings, I thank God.
Could you trace your career path for us?
And I cannot but stop to give credit to my husband, who at the time, as I was finishing medical school, by my last year and a half in medical school was when I met my husband today. And he had just returned from the United States, where he studied chemical engineering and had done his business management degree at MIT, and had returned home to do the youth service and to return, to stay home.
Well, that's Dr. Ike Uku, right?
This is Dr. Isaac Uku, that's right, Ikechukwu Ike.
Right.
And I had told him of my experience in 1979 and that I did actually want to go back to the United States to do my postgraduate course. And I knew that that would be a major, I would say, sacrifice on his part, because he had come back, he had returned to Nigeria to settle. Yes. And that meant that he would have to come back here again with me, not that it wasn't his desire to do so. Now, he actually helped me understand what it would take for me to do my postgraduate education in the United States, the types of exams I needed to take, and actually started at the time to provide me with the journals, the New England Medical Journal, and the questions, past questions that are available, different courses like Kaplan, that I could take to prepare me for the exam that was called at the time the visa qualifying exam, to qualify for that, to be able to get into an accredited medical school. So I do give him that credit, and of course to my father that helped shape that.
And your father's name, by the way, for the record, is Obiekezie?
Obiekezie, James Obiekezie Chibunze Ude. Okay. That's right.
All right.
So, so my path started in 1983. We got married, and we both came to the United States in 1983, and started our new life, young life together. Right. And in 1986, then we had our first two children, and then in 1986 I started my residency in internal medicine at the University of Tennessee Baptist Hospital. Now, the internal medicine residency is a 3-year program, and by the 3rd year, you have to decide if you want to do a postgraduate fellowship, or start your practice or join a group. And I chose to do a postgraduate fellowship. And I did that in infectious diseases at the Vanderbilt Medical School. Okay,
that's how you got into research, and
that's where the interest in research was sparked.
Okay.
And the infectious diseases fellowship is a 2-year program, typically, or some people might stay for a 3rd year. And I was offered the chief of the infectious diseases at the VA hospital, so I stayed there for a year. But meanwhile, my mentors at Vanderbilt had actually helped me a lot, because that's when my research work on HIV/AIDS also started. We had an NIH grant, and I was the first fellow for the pathogenesis and pathophysiology of HIV/AIDS. So in 1992, Merck was at the time looking for someone that had this type of specialty that would help lead the HIV protease inhibitor program at Merck, either on the clinical research side or the regulatory side.
Merck is a pharmaceutical company.
It is. Merck is a pharmaceutical company, and that's how my career in pharmaceutical research started in 1992.
Okay. And what were some of your proudest moments while at Merck?
Well, I think by no doubt at all, what would be considered the proudest moment would be, for me, the moment of the approval for the Crixivan, which is our HIV protease inhibitor product for the treatment of HIV/AIDS.
Right. Now that product is used even on the African continent.
It is.
Okay.
It is. And there have been many more HIV protease inhibitors since Crixivan.
Right.
Yes. Okay. But the reason that would have been my proudest moment for that period at Merck was that the data that we were generating were simply phenomenal. And in the process of drug development and approval in the United States, for some drugs, especially innovative medicines, there's typically an advisory committee meeting where the drug company presents their data publicly. And the experts and the regulatory agencies are there to review and debate and vet and ultimately endorse if that's what they choose to do. And at this session, we had other companies also present their data. It was interesting and truly amazing how impressive the data for Crixivan were at the time. And this was a period, this was in 1996, a period where there was very little hope for patients that were infected with HIV. It was almost an invariably fatal condition. And the introduction of HIV protease inhibitors in general, not just Crixivan, because there were many more that got introduced subsequently, significantly reduced the mortality associated with HIV/AIDS and turned it into a chronically manageable disease.
Okay.
Yes.
And then from Merck, you went to Wyeth.
That's right. That's where I am
Another
now.
pharmaceutical company based in New Jersey, where we are.
That's right.
Okay. And what position do you hold at Wyeth now?
I am a vice president for worldwide regulatory affairs for the research, Wyeth Research, and my responsibility spans the pharmaceutical products, the entire pharmaceutical portfolio for Wyeth.
Fave.